Hello and good evening. I'm Melisa Idris. Welcome to The Future is Female. This is the show where we find the extraordinary in every woman. I am delighted to introduce my guest today, Nurse Maheswari Jaganathan, who is Deputy Head of Community Outreach at Cancer Research Malaysia. She was named one of the top 10 finalists for Aster Guardian's Global Nursing Awards 2025. Welcome to the show, Mahes. It's good of you to join me.
Thank you,
I mean,
Melisa.
this is such a remarkable achievement. Congratulations, I would have to say first and foremost.
Thank you so much.
So, I mean, clearly this is a global recognition of your work and your journey, your contribution. Maybe you can share a little bit with us what your journey has been. Maybe tell us a bit about yourself and your journey and what drew you to nursing.
Nursing, okay. I've been in the nursing field now about 24 years now.
Wow.
And started, I mean, where I started was actually in an accounting school.
Okay.
That was
so you never, like, did you picture yourself as a nurse as a little child?
No.
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 Oh.
But there was a lot of drive for me to go and work with with people.
Okay.
And at the time, you know, after Form 5, family preference was to go into accounting because family was doing business and they wanted somebody to really know how to keep money. And so because being eldest, then you've been dragged into that. But of course that I don't feel, I truly don't feel like it's something that I really wanted because I hate accounting anyway when I was in Form 5.
So it didn't fit with you, didn't
yeah,
jive? Okay.
I always feel like numbers drives me crazy and I don't like numbers. It was just about like 8 months in the whole course, and then I was walking back in one of the night class. In the cafeteria there was a newspaper left behind in the cafeteria, so I brought that back, and there was a nursing scholarship then. Yeah, so that's how I went into the nursing field.
But what kept you in the nursing field for 24, 25 years?
Yes, I think it's how you use your identity, your skill and your knowledge to be able to help people at the most vulnerable time. And not everyone is been gifted in that kind of nature, or maybe to be in a situation to see people in suffering, but at the same time you have to really act and be the person who will actually lead them to the betterment. Yeah.
Okay, so you clearly love this work, that you feel this is a vocation for you. Why do you think the Aster Guardians Awards people picked you, noted you for your contributions? What was about your work that you feel that they recognized?
So Aster Guardian is looking into legacy of the future nurses, right? So in my 23 years, for the past 15 years is the time that I have spent into coming out from bedside nursing. I mean, nurses are really great when it comes to bedside nursing, and it's just invaluable, and no doubt. But you know, sometimes nurses are only given the chances, or maybe there is only opportunity to be where they meet, but not where they lead. So I was looking into how can I use this experience, the knowledge and also the skill to come out and do something different in system change making. So most probably what I was working on, and when I joined right after coming back from Middle East, after 5 years of experience, I came back to Malaysia and I joined Cancer Research Malaysia. That's when the opportunity came to start a project called the Patient Navigation Program. And at that time, the survivorship of breast cancer patient in 2010 was at 47%, and we were actually one of the poorest in Southeast Asia. Wow. And at that time, my knowledge while I'm working in the Middle East was very helpful to map out and start doing the mapping out of patient journey when they are going into breast cancer care.
The pathway, essentially.
Pathway.
Okay.
Yes, the pathway.
Right. So you're absolutely right. I think that sometimes nurses are often seen as frontline caregivers, but not as so much as system changes, right? But you really flipped that on its head. You decided that you could do more than just care for patients. You could actually change the system itself. Talk to me about the patient navigation program. What was it that you saw that made you, that frustrated you, that made you want to change the system?
Right. So when you look at the way that how usually any newly diagnosed breast cancer patient, okay, they might be coming from the primary care clinic, which is Klinik Kesihatan in Malaysia, and most probably they would have been given a referral letter saying that something suspicious. When they arrive to the hospital, right, there's more complex or more complicated journey in the hospital, but many of the women might not know about it
and feel intimidated.
Yes, and sometimes when people say when they refer to the bigger hospital, right, hospital besar, and they always think like hospital besar means masalah pun besar, right? So when they arrive at the hospital, the entire journey from the suspicious to the diagnosis until they get the breaking of the news, and then the doctor talks to them whether they go for surgery, or if it's not operable, they will go for chemotherapy to shrink the tumor. It's a long process. But I was looking at what is the strength of a nurse in this, right? Like I can actually literally watch them, and I know what can I do. And while you are in the ward, in inpatient, you'll work on shift basis. Most probably you will see patient when they come for treatment or maybe go for surgery and all of that, but it's a very short time. But what patient navigation does is that you tag with them along until they complete the treatment.
So patient navigation, the patient navigation program which you created essentially is is it partnering a nurse with a patient? Is that what?
So it's a tagging program where is a patient. We introduce a patient-centered program that can actually guide newly diagnosed breast cancer patient to complete the treatment and overcome the challenges so that their life-saving treatment is not disrupted.
Okay. You noticed that without having someone navigate them through the system, they would fall out of the system?
Yes, because the journey for breast cancer, based on our observation study, if let's say they come very early, it's about 8 months. But if they are not coming in early stage, it can go into 2.5 years. So it's a very long process and it's a long time. And if you look at another reason how did Cancer Research Malaysia brought the patient navigation program is also when I came back from Middle East, I was having this knowledge of how to navigate patient in the ward. So I'm coming from really bedside, bringing up all the excellence for patient care. And our past Chief Scientific Officer, Professor Dr. Teo Su Huang, was also, she won a Eisenhower Fellowship, and she wanted to understand how did women in the Western country improve their survivorship. And at that time, Dr. Harold Freeman was already pioneering patient navigation program in 1990s in Harlem, New York.
Oh, wow.
And that particular program was also started with breast cancer.
Okay.
So she brought back the aspiration, and with the aspiration from there, and because we are part of the research organization, the aspiration, the research background, and at that time we also had a funding coming to us through the ladies professional golfers, Yayasan Saim Dabi.
Okay.
And then so
you had everything happen at the
same time.
Yeah.
But at the same time, right, even though we have all of this, because we don't have patient or the pool of patients, so we need to go and pitch.
Okay.
And we were actually walking to the nearest hospital, which is Hospital Tengku Ampuan Rahimah in Klang. So we were walking and trying to convince them and talking to them.
Directly to patients?
To the hospital.
To the hospital administrators.
About, like, you know, if you tag patient navigation program to the breast cancer patient management, it will improve.
So you were trying to convince them to take on the patient navigation program? Because
we need patient, and we need to integrate them to the breast cancer management. So it was a long walk, 4 years. But was all worthwhile, and there was, after 4 years, one of the retiring director, I think the third director of the hospital, actually gave us a 290 square feet room, underused, a quality meeting room, said, prove yourself, And that's where we started, and where we built the demonstration model was the same hospital where I lost my grandmother who had a cervical cancer. So I always believed that, you know, the hospital has something to do. When I was 10 years old, going to the hospital, watching her, waiting downstairs for children, you know, young children were not allowed. So I used to hate the hospital so much because, you know, it took away somebody that you love.
Yeah.
And when I went into the posting as well, I went back to the hospital. Same hospital for my nursing diploma. And then I did some specialization in midwifery. After that, again, another 1 more year. And then I left to the Middle East for 5 years. That's where I went into specialization of patient navigation program and all of that. Very little I know that I will come back and I will build back the demonstration model in the same hospital.
My goodness, what a full circle moment.
Yes.
This hospital must be very special to you.
Very, very special.
So was that the turning point when people really started to listen to you that this program can work, when somebody gave you a chance and say, here's a room, prove yourself?
Yes, yes. Because the whole idea was from US.
Okay, so it was just about implementing it here in Malaysia.
Yes, and
what nuances did you have to adapt it to a Malaysian context? Because you can't copy paste a US program to Malaysian program.
Yes.
Was there some changes you need to make for Malaysian?
So for Malaysia, we really needed to map out what is the patient's journey, her experience, their challenges. At the same time, we also really needed to really understand what is the gap in the system, healthcare professional that is working with the breast cancer patients. So holistically, so for the past 4 years of us waiting, we were also trying to be more alert, aware, what is the current need of the real breast cancer patient.
Could you maybe illustrate it with an example? So when you think about some of the patients, what would you say are some of the biggest non-medical factors that keep them from moving through the pathway?
Okay, so when most of the referral centers, so when they come with suspicious finding, they need to get to a facility that may have mammogram. So if they don't have, the healthcare system, the Ministry of Health healthcare system is, they will always refer you to the nearest. And sometimes for women who are coming from the rural area,
it's not equipped. That clinic is not equipped or something.
Yeah, so sometimes they have to go to the bigger facility in the center of the town. So first of all is the transportation for them to go beyond the clinic kesihatan to go for the diagnosis. When they arrive, right, because the process is not only going through one diagnosis. To get a diagnosis for breast cancer, they need to go for a mammogram, followed by an ultrasound, and then followed by a biopsy. So
multiple.
Yes, and sometimes women can go for 3 different days to do all these 3. But what we as the navigation team have actually negotiated together with the Ministry of Health is having it on the same day on the arrival. So we try to cut a lot of time that we can actually save. So you come in and you do it all and then you go back. And then after that is health literacy. A lot of women may not know exactly what is a sign and symptom of breast cancer. It can be something normal, and sometimes we also found in our study, women who find any suspicious finding, if they are not telling that out to anyone, they have no one checking on them. And these are the people who can actually become a patient with delay presentation. But if only they speak about this delay, this sign and symptom to somebody, that can actually help
Meaning
women.
if they find a lump or there's an unusual, something unusual about their breasts, they tell somebody, hey, this is happening to me.
Yes.
So
and that
usually
particular
they don't.
person, usually they don't. If they say it, then somebody is checking on them. Have you gone?
Okay.
Like your accountability buddy. If you're telling someone, and this person, if let's say they are not telling the right information, a lot of women might sometimes say that maybe it's breast milk engorgement. Okay. Maybe it was subside. Yeah, it's not cancer. Somebody saying the people, if they don't tell someone, or the people who hear it and is very, very responsible to divert them, just go to the hospital, get it checked. It should be the right way of doing it. But these are the two factors sometimes can bring patient to become delay. And then money. Financially, even though that Malaysia have universal health coverage, there's a lot of costs that can have to be bared by the patient, the out of pocket. Paying for the travel, sometimes you need to get Grab, sometimes you need to do parking, you take a highway, those are all out of pocket. That's not even included in the, the cost which is subsidized and is at an affordable price in the Ministry of Health hospital. But these are the things that they cannot, it is something that they have to pay out of pocket.
And it adds up, right?
Yes, and sometimes when they have to come for hospital, who are there to care for their elderly at home, child, very young children. And sometimes when they are going for work, some of the work, most probably if they don't have, they are just, maybe they are working on daily wages or they are working on contract. So it is very difficult for them to just take a time slip or a MC. Very different type of issue faced by women.
Which is why it must have been so important and impactful for a simple thing like making sure the one trip and they get all the 3 procedures done at the one time instead of having to come back 3 separate times. Can I ask you, Mahes, what impact you're most proud of with this program?
Okay, so now the partnership together with Cancer Research Malaysia and the Ministry of Health. Since January 2015, we have navigated...
it's been 10 years.
Yes. 2015, we have navigated almost about 5,000 women across Hospital Tunku Abdul Rahimah, which was our demonstration model, and then State Referral Hospital in Kuching, in Kota Kinabalu, and also Negeri Sembilan.
Okay. Do you see the potential for this being scaled up throughout the country?
Yes. Currently, Ministry of Health is, we have very good and high support from the Ministry of Health because this is a public and a private practice that we are doing this. So we are scaling up starting from these 4 centres that I mentioned. So last year we have signed an MOU for a centre in Kedah, HKL, Kelantan, Kota Baru, and also Perak Ipoh. And and we are also going to establish an enhanced navigation model in Sabah and Sarawak, where it will consist of almost about 18 hospitals. Because in Sarawak and Sabah, geographically, patients have a lot of challenges, the intensity.
Do you think, Mahes, that this model can be replicated for other diseases, so beyond breast cancer? Do you think that there could be an application for other diseases as well?
Definitely yes. So we do have a lot of, question, do only breast cancer patient die and is only breast cancer patient?
No, we're not diminishing the thing, but I'm sure it could be,
yes,
right? Yeah.
So while we are starting this with only breast cancer, if we have established the pathways and the way that we work with our breast cancer patient, I think it will be faster for us to establish for different cancer. Maybe we need to train a team with the body of knowledge. Like now, if somebody is taking care of breast cancer patient, we need to know what to do before surgery, after surgery, during chemo, radiotherapy. So same goes to different type of cancer. So the team has to be like team of excellence.
Yeah. Oh wow! So was that difficult to build the capacity within your team of excellence to make sure that they themselves are equipped to guide patients through the pathway?
So currently the training is done in-house, and I lead the training for 2 types of navigators. One is nurse navigators who will be in charge of medical navigation. So their medical navigation will be attached to all the clinical pathway decision making in going to all the medical decision with the doctors. The second one, we call them as community navigators. So community navigators are social welfare officers. So in our model, we have bring the social welfare officers so that they can actually use their skill and knowledge on how they want to navigate patient with disease. At the same time, due to their expertise, right? Like, you know, social justice, they look into...
They can navigate the welfare system as well,
yes,
right?
Due to the social determinants, they can actually... We have social welfare officers going to Arden office representing patient. We have... we even have gone to even court to represent patient. So we use two type of expertise, and these two type of expertise were actually choreographed based on the need assessment information that we found that these are the gap. So in order to close this gap, the solution is to convert that to a job description, and the job description fall into these two people.
Nurse navigator and community
navigator.
I have to tell you, Mahes, I can only imagine how reassuring and comforting it must be when somebody is going through probably the worst period of their lives, getting a cancer diagnosis, to have someone to be able to help and rely on, I think is remarkable. This is a wonderful program. With the award, with the recognition that came as a top 10 finalist for the the Aster Guardians Award, can I ask you what that meant for you to be recognized on a global stage? And I wonder also, if not just for you personally, but for nurses everywhere, for community navigators everywhere, what do you think it means to them?
I think, of course, beyond personal recognition, I always feel like that, you know, all of us have different strength, and we carry a different identity. And when you carry those identity, right, at any situation, those identity is for others. If let's say I'm a nurse, I'm sitting down and talking to a patient, and who is having this confusion about should I go for radiotherapy or not. But you know, my knowledge will help and demystify all her confusion state and all of that.
Nurses, I think, well, actually I should ask you, do you think that the emotional labor that nurses undertake, and nurses are mostly women, do you think that's undervalued in our healthcare system? This immense emotional labor that nurses give?
I think at this point of time, I think after COVID, a lot of constraint in healthcare, especially human resource in healthcare. But I think nurses are doing a wonderful job, especially in the Ministry of Health. They are doing a wonderful job, and additionally, into a system that is actually trying to do the best for the Malaysian women. What Cancer Research Malaysia, because the project is being funded by donors. So our seed funding for the first 4 hospitals came from Yayasan Saim Dabi, and after that Yayasan Petronas has come over to help us to go far and establish more centres. So beyond just looking at a hospital, when we say government hospital, you know, they are struggling and all that, we are going in giving our strength. We bring different strength into this entire solving the problem together. I mean, like for Cancer Research Malaysia, we bring in, we add the nurse navigator and community navigator. Their salary is paid by us. But they are based in the hospital. Right. And then we also, through the donors, we have financial reimbursement prepared for women. So when
for the patient?
For the patient. So when they're coming in on arrival, usually when you see a single mother with 2 children who are not even 12 years old, who are traveling like 52 kilometers on only depending on public transport, right? So today, before she goes back, the navigation team would do a profiling to see what will happen to this patient in 14 days if she's going to have cancer. So the nurse navigator and the community navigator will actually do an interview, and we already know the prediction. And from there, we will actually do a plan. How will we bring her, align her to the recommended treatment? So on the day that the doctor will actually break the news to any women saying that is cancer, on the other side, the navigation team will say, look, we have all of this planned for you. You're going to get a Grab to come for all their hospital appointment. Your children, while you are going for chemotherapy, we will actually pay for you so that somebody else is looking after your children. And if let's say that you are not working, we try to help you to have groceries at home, at least for the first 2-3 months. While doing that, the community navigator will start looking at what are the initiatives that is already available at the national level. So like My Salam, Pekabi 40, or we will even leverage on Jabatan Kebajikan Masyarakat. If let's say she's a single mother, they will start doing all of this planning. But you know, certain things will come later, 2 to 3 months. But now, right, if you want to get trust from women who are really vulnerable at the state, you really need to show them that you care and you provide them immediately with the money, because that will help them to come and listen and be in that recommended treatment plan.
Mahes, I'm so moved to hear this. I think it's a wonderful program. Congratulations on being recognized for the work that you do, and I wish you and your team all the success in the world. I hope we get to scale up this wonderful program so it helps more women here.
Thank you so much, Melisa.
Yeah, thank you for talking to me about it today.
Highlighting the patient navigation program. We hope that one day we have a centralized patient navigation program. And
a one-stop center.
It's a one-stop center. So now itself, the Ministry of Health is already providing us a space called the one-stop center, called the Pink Ribbon Center. That's where the patient goes. But we want it to be not only limited to breast cancer patients. We want it to be more to different type of cancer. One
day we'll get there. I have faith in you.
Yeah.
Thank you so much, Mahes, for talking to me today. I appreciate your time.
Thank you. Thank you.
That's all we have for you in this episode of The Future is Female. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.